in my own experience as a GP for the last 20 odd years, it changed the way I approach patients. It made me less reliable on other services because I have nearly everything out of this Medicube on a regular basis. I'm Dr. Al-Shamaa and the clinical lead at South Downs Healthcare. We're leading on the urgent treatment center, which we call it offside, because we're trying to change the narrative of attending the A&E department at the local hospital for an urgent GP appointment. And at the same time, I'm a private GP with South Downs Healthcare, and we're promoting preventative medicine as well as health and well-being. We don't just offer GP appointments, we have a whole well-being center, including a swimming pool, a gym, Pilates classes. We have in-house physiotherapists because we need to move to proactive medicine. We need to focus on the mental and health well-being of individuals, and we should not rely on them seeking advice from us once they start living the illness or the disease. We try to work hard with them to prevent it from happening to start with, or to take an earlier measures for a more sooner diagnosis and management. A move away from having to do blood tests or refers the individual to another service. You sit average 5, I've done it in around 5 minutes, and most people manage to do it within 5 minutes, and give you an indicators about your health well-being, about your blood pressure, about your heart rate, about the possibility of getting diabetes. There's a lot of predictive values in the Medicube that I found magnificent and does help clinicians on a daily basis. But even today, I've seen a few patients earlier, and I've used it in nearly 50% of the clients I've seen earlier today. Whether I want to double check on their blood pressure and their heart monitor, whether I wanted an ECG to look into your rhythm, or whether I want to use it as motivator that you are slightly overweight and we need to work hard together to achieve a better, healthy lifestyle. You wouldn't believe the change to the way, even the way we practice on a daily basis. So normally we would have sent people to have an ECG outside. We might need to get help from a nurse practitioner or a practice nurse or healthcare assistant. Now, if we suspect any issues, we can put the patient in the Medicube and get all the markers that will help me to make an easier diagnosis and reach a conclusion and help the patient to move forward. We've widened the use for it, and I think there is a trial period where we are trying to offer it to all people who are waiting to be seen, regardless of the clinical presentation. And the way it's designed, of course, it'll give you a strip of information, and that strip will be handed over to the clinician, whether myself or our paramedical practitioners or our experienced nurses or GP trainees, and we'll be able to signpost the patient to the right service and right direction. There's a lot of curious individuals. Every day when they go to their Pilates classes, I see them having a look around, and I invited a few of them to just have the lived experience. And a few of them I've been seeing on a 3 monthly basis because they want to monitor their body fat percentage, their risk factors, and whether with their working hard on their lifestyle, whether they achieved a positive outcome. I've got one of my patients, I call her regular. She's a healthy lifestyle-oriented individual, and she uses it as a platform to cut down her overall cardiovascular risk, which we were able to calculate based on her lived experience in the Medicube. And every 3 months she's been attending to calculate her risk factors, and you can see visibly how her risk assessment dropped from a lower grade to actually normal level over the last 9 months. There was another client, and part of the Medicube where they do the 2-lead ECG, which is the heart trace, we picked up atrial fibrillation. She wasn't aware of it, and that's life-saving because she was just about to go on a trip, and of course that could have created a lot of unwanted complications. And that 5 minutes stay in the Medicube, managed to pick up a heart irregularity, and we managed to confirm the atrial fibrillation. She's on the correct treatment before her trip. And there is no need to wait for the illness to occur before seeking advice. We're selling the idea of it's not just about you get the medical problems and seek help. If we offer regular reviews, regular checks, including, of course, the use of the Medicube, which has been an excellent addition to us at Hillbrow, where we can help individuals to assess their cardiovascular risk, as well as their chances of getting any significant medical problems over the coming years. I think Medicube will be essential within the near future at GP practices, health centers, walk-in centers, private entities, whether they are private hospitals, aesthetic clinics, or private GP providers. Because I think globally, and even nationally within the United Kingdom, there is a drive. There are a lot of incentives. There are changes to general practice contract where there's more focus on preventative medicine and GP practices in general to be more proactive in care rather than a reactive one. But of course, the drawback is the pressure on daily practices and GPs, a lack of resources and lack of appointments, and the manpower behind it. That's usually the usual challenges that we've been facing in general practice over the last 2 decades. This is the perfect answer. It can monitor a lot of vitals on a regular basis and give you better direction in life.